Hi, my name is Casey, and I'm a full-time certified hand therapist. I wanted to share with you today about how to take care of your C-section scar. I've had two C-sections, one in 2015 and another in 2017, and I thought I'd share today a little bit about what I know about scar management, both in hands, and kind of apply and teach you guys how to apply it to a C-section scar. So what research is showing is that it's not necessarily what you put on a scar that matters. It's more how you put it on, and then kind of what you do to decrease the what's called tensile force across the scar. So I wanted to share with you my picture of my very first C-section scar and kind of show you the before and after picture. Staples were used to close my first incision, and then sutures were used to close my incision after my second baby. So I'm familiar with both. This is what it looked like the day after, and then this other picture is what it looked like after I got my staples out. And then this is what the scar looks like when it's fully mature. So what I use to take care of the scar, and actually any scar that I use or to treat in hand therapy, I use just basic Palmer's cocoa butter. It's really cheap. You can find it at Walmart or online. It's usually at the bottom shelving in the grocery store because it's inexpensive and it doesn't need to really be oversold. So I like to use the ointment or what comes in kind of this jar here. And again, it's just Palmer's cocoa butter. As long as you're not allergic to it or allergic to any of the ingredients, then it's fine to use. The reason why I like it in a jar instead of like a pump bottle or like a lotion form is because the skin doesn't absorb it as quickly. So it has more working time for the scar. So all I do is I take a little bit off on my finger here, and then any scar that you have kind of, as long as the edges of the scar are healed up and solidified, then it's fine to work on it. If there's any scab left over or what we call eschar left over, you want to wait till that goes away in order to work on the actual scar itself. So I'll show you on kind of my hand, because it's easier, how I would do it and kind of what to do. So I would take a little bit of Palmer's cocoa butter that I just got off and put it across the scar, and then work it in small circular motions, kind of up and down the scar. Small circles as firmly as you can tolerate without having pain. If you have pain, you're pushing too hard. Just kind of small circles up and down, again, as firmly as you can tolerate without there being any pain. And I tell my patients to do this 3 times a day for about 3 minutes or so when you do it. It takes about 2 years for scar tissue to fully mature. So you have 2 years to kind of work a scar. And then once you're beyond the 2-year mark, kind of what you see is what you get. But at that point, the scar is usually fully mature. It's more light in color. It's white usually, or lighter in skin color, pigmentation, depending on your skin tone. So you have up until 2 years. The earlier you do it and kind of manage the scar, the better it is, and the better outcomes you'll have. But you'll have the ability to kind of work the scar for 2 years. Now the other thing you want to kind of consider is what's called tensile strength across the scar. So when scars come together and heal, they kind of come together and grab onto one another and then form this scar right down through the middle. So as you're healing, if there's a incision that kind of goes along this way and you're constantly pulling on the incision site, the actual scar will start to gap and you'll get a little extra room in between, making your scar look wider over time. Now, obviously you don't want that, and because it doesn't help the appearance of the scar. So you want to do things that you can do, or anything that you can do to keep the edges of the scar kind of together. Now you can use scar tape. There's specific tapes out there, skin tape or paper tape, that can kind of decrease the tensile force. Really, any kind of wound care tape that you get will, and taking one side of the skin and taping it to the other side of the skin will help to decrease some of that force that's happening there. You also want to kind of be aware of how much you're moving, twisting, turning, bending down, lifting, kind of coming up. There is a reason that your doctor advises you not to do those things, and part of the reason is the scar itself needs a chance to heal. The only product that I know anecdotally that can help the overall appearance of scar itself is something called silicone-based gel sheeting, and there's lots of different brands that are out there, but it's just silicone. There usually should have no adhesive on it, but all it does is it kind of goes over the scar. You can wear it at night, or a C-section scar, really you could wear it all the time because it's not really going to get a lot of use in that area for a while after you have the baby. So you can wear that, and it will help to minimize the appearance of the scar. Research doesn't tell us why it works. There's some different theories out there. One of the theories is that it decreases the oxygen available to the scar, and then the other theory is that it keeps it really moisturized and moist. So I recommend wearing that in between sessions that you're doing scar massage, or anytime you're not in the shower. When I had my baby, I actually put silicone gel sheeting over the incision, and then because I was so busy with the baby, I forgot about it, and it was on for a week, sometimes even up to 2 weeks without me thinking about it. So it lays flat, and it's easily acquired. You can get it on Amazon, Target, Walmart, any of those places. And that's it. That's what a hand therapist knows about taking care of scars and how it applies to C-section scars.